Welcome to the Better Health Now podcast. Today I have the opportunity to sit down with Dr. Smith, Chief Medical Officer here at Cullman Regional. Thank you so much for joining me today.
Glad to be here.
Yeah. So before we kind of talk about the topic of Hospitalist, the Hospitalist program here at Cullman Regional, I want to set the story with a little bit of your background. Talk a little bit about your journey to get here. I know you've been here for 36 years, and why would you ultimately pursue the career in medicine?
So, since an early age, I've always wanted to be a physician. I was really the only physician in my family, and was fortunate enough to get accepted to the University of Alabama School of Medicine after I finished college, and did my medical school training there, and then I did a surgery residency following that at Caraway in Birmingham.
Okay.
And so while I was a surgery resident is when Caraway became a level 1 trauma center. So I was involved with that development at Caraway, which was really an exciting time to be a surgery resident.
Yeah. And so I know prior to coming to Cullman, you kind of spent a portion of your career traveling around the country, educating other surgeons on a particular surgery. Can you talk a little bit about what that experience was like for you?
Sure. So, and actually it was after I matured in my practice in surgery. I did a variety of surgery, chest surgery, vascular surgery, and general surgery. And with chest surgery, I was involved with the early adoption of thoracoscopy or videoscopic assisted lung surgery, where
Okay.
you use tiny telescopes to go inside the chest and remove tumors or lobes of the lung. And so early on, I was involved in teaching courses related to that to other thoracic surgeons around the country. And that was an exciting time as well. And I've always had an interest in minimally invasive surgery, and my practice has grown through that as a surgeon in Cullman prior to becoming the chief medical officer.
So I know you've been here at Cullman for 36 years, so you've seen Cullman kind of grow. But the topic that I wanted to discuss today is the Hospitalist program. Can you talk a little bit about what Hospitalist medicine is and kind of why that adoption of that program for Cullman happened?
Well, really, hospitalist medicine is a specialty that has evolved over the last, 15 years. The last 5 to 10 years, it has really exploded. And it's a specialty where the physician is committed to just taking care of patients in the hospital. So it's being available and understanding the kind of conditions that cause people to be admitted, to a hospital. Usually folks are sicker, although sometimes, they may come in for an elective operation, have a medical complication afterwards, and have to be managed by a hospitalist. Typically, hospitalists are trained in internal medicine or family medicine,
Okay.
Or pediatrics, usually the medicine side of things, to provide that support for other physicians in the hospital. Over time, the medicine physicians, primary care physicians, who typically admit the largest number of people to a hospital, have become, very busy in their office, to where it's very difficult to be two places at one time. And so having the hospitalist specialist to take care of patients in the hospital allows the primary care physicians to be in their office and provide the care their patients need in the office.
Yeah.
It's very disruptive to patient care for a primary care physician if they're having to run back and forth to a hospital, managing a sick patient in the hospital and trying to take care of the needs of patients who are trying to see them in their office. And so typically, primary care physicians that are staying in their office are really focused on trying to keep people well and keep them out of the hospital. And the hospitalists, on the other hand, are taking care of the folks that unfortunately have conditions that cause them to have to be in the hospital and manage them there in the hospital. So it's really a collaboration between the primary care physician and the hospitalist to be able to offer this service to patients, and they sort of get the best of both worlds, because you're getting the best out of your primary care physician to try to keep you well, and you're getting the best care from specialists who are used to taking care of folks in the hospital, understand the system, to try to help minimize your length of stay in a hospital. Be sure you get the best you need and get out as quick as you can in good shape.
So I know. So it's ultimately up to that primary care physician whether or not they want to opt into this or not.
Yeah, it's really, and our program in Cullman is a volunteer program. There's nothing mandated about, patients have to be admitted to a hospitalist program. But our primary care physicians in Cullman are very conscientious about their office practice. And they want to optimize that, and they want to be sure that the patients in the hospital get the best care they can get. So being able to have a hospitalist program is really a big advantage for the primary care physicians to have that available to them. And the care coordination that comes on the side of the hospitalist, really helps facilitate efficient management of those patients in the hospital. And then the biggest advantage is with our hospitalist program, we have a provider available in the hospital 24 hours a day, 7 days a week. And the primary care physician just simply can't do that just because of the nature of the practice that they're trying to manage. So it really fills a gap that patients need. I know patients are always asking, why can't I see my doctor in the hospital? Actually, you can, but you really need to understand that there's communication between the hospitalist and the primary care physician. There's a lot of interchange, sometimes communication going on during the hospital stay. So there's information exchange, but that's probably the thing that patients, they love their primary care doctors and want to see them, and so that change has been a little difficult for some people to adjust to. But amazingly, in Cullman, patients have become much more adapted to it. We started a hospitalist program around 2012, and there was a lot more pushback from patients and upset patients at the time. And then we went through a period of time where we contracted with external sources to provide hospitalists. And that was still not the best patient satisfaction, because we did not control who those hospitalists were, and we would sometimes be surprised with new faces that we were not expecting. And so in 2020, about May of 2020, we made the decision to employ hospitalists and make the hospitalist program part of our Cullman Regional Medical Group, which is a large multi-specialty group. And by doing that, we suddenly got control of being able to pick the best physicians to provide the care and create standardization of care so that there's a consistent approach to patient care that hopefully is, and I think it has, increased patient satisfaction in the hospital with our hospitalist program. We've got a great group of physicians. We staff our program keeping the number of patients per hospitalist at the lowest number that's the industry standard to keep it safe. And by us employing those providers, it just really makes it a lot more seamless to be able to make sure we're staffed appropriately every day and that folks are doing what needs to be done, and most importantly, working collectively as a team.
Yeah. And I would assume that as you've kind of adopted that in May of 2020, a lot of the primary care physicians that have opted into having the hospitalist program have gotten familiar with those physicians that are in that program, so that when they bring patients on, there is that synergy between the primary care and what's happening on in the hospital, and that communication element is stronger.
Exactly, and by employing the hospitalists, these hospitalists are part of our active medical staff. They're members of our medical staff committees. They're attending the same committee meetings that the independent primary care physicians are attending. So there's interaction on a continuous basis, which also works to our advantage.
Yeah. So for patients, you mentioned some of the benefits that they can see from the hospitalist, that they're in it on a day-to-day basis, and it allows their primary care physicians. Is there any other benefits that you've seen that maybe are smaller benefits but really impact the hospital stay for the patients when they have the hospitalist being there with them rather than their primary care physician?
Well, one of the biggest things is care coordination. So in a primary care practice outside the hospital, continuum of care and care coordination is focused on keeping people well and hopefully out of the hospital. In the hospital, care coordination is really how do we make sure that this patient gets what they need while they're in the hospital, and then make a good decision about where do they go when they're discharged. Do they go home? Do they go to rehab? Do they go to an extended care facility? Or do they have some condition that needs a higher level of care and they have to be transferred? And making those decisions and accomplishing those tasks can be quite cumbersome. And by having somebody physically present continuously in the hospital, those things can be addressed quickly. A lot of third-party payers, a lot of insurance companies have a lot of paperwork, a lot of hoops you have to jump through just to get a patient from the hospital to a nursing home or from a hospital to rehab. And it takes daily interaction, ongoing, with the case management team in our hospital, social workers in our hospital, and nursing to get those things done. If a physician is having to run back and forth from their office to the hospital to try to do that, it usually results in patients being in the hospital longer. So we've been able to efficiently and appropriately reduce hospital length of stays for patients, so we get people in the place they need to be as quick as they need to be there.
Yeah.
And that is a huge advantage for patients. Our hospitalists meet every morning. We have a hospitalist huddle every morning, and they meet with nursing leadership from each nursing unit in the hospital, case management, social work. They meet with, they meet with case management, social work, nursing directors, physical therapists, and I mentioned social work, but that's a huge component of what we deal with. And by having everybody in the room at the same time, we're able to expedite decision making for the hospitalist providers. So the hospitalist is trying to figure out, where does my patient need to go and what are my options? Case management can be there to say, well, we have these options available to that patient, and it really streamlines care and the decision making. But adding that meeting to a provider's day would be a big negative impact on a primary care physician who's trying to get back to his office.
Yeah.
So these, it's sort of been it's totally redesigned how patients are cared for. I mean, at the end of the day, practicing medicine is you have medical conditions and there's drugs you prescribe and procedures you do, but there's so much more to getting a patient better out of the hospital where they need to be, so that they can follow back up with their primary care physician and continue that path of hopefully staying out of the hospital in the future.
Sure. Yeah. So I know you talked about the evolution of the hospitalist program in 2020, where you kind of brought in-house people. Where do you see the future for this hospitalist program here for Cullman Regional? And do you see there being another iteration that kind of ups that standard of practice that the patients would be experiencing while they're in the hospital?
So, I feel like if you look nationwide at what's happening, hospitalist programs are growing. I think 75% of hospitals nationwide utilize hospitalist programs, and I see that growing. If you look at Cullman, as I mentioned, it's a volunteer program, and in 2020, when we began employing the hospitalist, we were seeing about 40% of the hospitalized patients. And two large primary care groups in town were still trying to see their own patients in the hospital. And they had worked out a model that they were sort of sharing the responsibility so that one doctor would see a lot of other doctors' patients. So it was sort of similar to a hospitalist program. But in about 2022, one of the large primary care groups moved their patients to our hospital. They had gotten comfortable with our group. So by getting to know the individuals and seeing the stability, the standardization of care, and the outcomes that they got, they felt very comfortable moving their patients to our group. And that was a volunteer decision on their part. So that increased the number of patients we were seeing. And then in November of this past year, the other large primary care group, for pretty much the same reason, their focus on their outpatient office care required quite a bit of time on their part, and they were very comfortable with the care they could get in our hospital, so they moved their patients to our group. So
Wow.
that has us now seeing about 90 to 95% of all the hospitalized patients in
Wow.
the hospital. And then the specialists, the general surgeons, the orthopedists, spine surgeon will consult our hospitalist group for care on their patients. If they do a procedure on them and they need additional medical coverage, they'll consult our hospitalist group. So I just see that growing, and I think the opportunity for us is by having these physicians employed, having stability in the group, having people that are in the community that are, relating to folks in our area will just make us stronger
Yeah.
and better. And I think continue to help the community feel better about the way the model has changed.
Mm-hmm.
It's very different than 20 years ago.
Yeah. So you've been at Cullman Regional for 36 years, and you've seen it continuously grow over your time being here. What sort of things do you hope to see with Cullman Regional as a hospital as a whole happening in maybe the next 2 to 5 years and their continued growth?
Well, I mean, I hope we'll continue to expand the services we offer and then improve the service, improve those services, even expand that. I mean, we have, we are really reaching out to our market area, which is beyond the, just the boundaries of our county.
Yeah.
Because our hospital serves a much larger area. There are people from other counties that come to our hospital on a regular basis, physicians in other counties that regularly refer patients to our hospital and, in fact, refer patients to our hospitalist program.
Wow.
So I anticipate that growing based on our outreach. I mean, and when you have something good like we have at Cullman Regional, and to be able to provide the outreach and bring more people in, just makes us all stronger.
Yeah.
And gives us an opportunity to, like I say, make the services that we do well better.
So with the name of the podcast being the Better Health Now podcast, what does that statement of Better Health Now mean to you?
Well, I mean, for me, it's just being able to, to be able to provide a standardized approach to care that's evidence-based, that emphasizes patient safety, ensures patient safety, ensures the highest quality, and do that on a daily basis.
Yeah.
And the way we have grown every service line in our organization has moved us closer and closer to that goal. I mean, I just feel like we are on the track for that, and I'm confident the next 5 years will show that.
Yeah. Well, I appreciate you taking the last little bit to talk a little bit about the Hospitalist program here at Cullman Regional. We'll have information for everybody listening in the episode notes if you want to find out more information. But I thank you for your time, and I continue to look forward to the impact you'll have in your patients' lives for years to come. So thank you so much for being here.
Well, thank you. I appreciate it.